It is yet another new year, and we are still fighting COVID-19. The state continues to set new records every single week. Today, we're talking about what the numbers look like as we start 2022, what to expect in the coming weeks and months, and what we all need to do to help fight the spread of COVID-19. So to do that, we're joined by Cone Health's Dr. Cynthia Snider, an infectious disease expert who's been helping us fight through this pandemic that's been going on for 2 years and answering all of our questions. So first and foremost, let's just kind of start with the numbers. What does it look like right now when it comes to hospitalized patients and those that are vaccinated versus unvaccinated?
Sure. So our numbers are as high as they were before our last peak surge. So we are anticipating that this coming week, maybe 2 weeks, are going to be worse than we've had ever before. So currently, at midnight, we had 250 patients with COVID, and this afternoon it's jumped up to about 289. Roughly 70 to probably 75% of folks are unvaccinated.
Okay, so when we're looking at these numbers continuing to climb, transmission rate in the community looks like what right now?
So we have a 30% positivity rate. So, 1 in 3 folks who are getting tested are positive. And I think a majority of people are going in for symptoms, but there are folks who are getting tested because they came in close contact with somebody who's positive.
Okay, and just how concerning is that for you to see the 30% and the number of hospitalizations?
It kind of takes my breath away, really. It is startling. I think we're going to come to a point where if somebody's symptomatic and is otherwise healthy, we would say, you have COVID. Right now you have a 1 in 3 chance of being positive, and for those who are seeking testing. And to realize that you are infectious to others. So it's really important to follow those CDC guidelines to staying home if you're seeking testing and waiting for those results.
All right, so you've already said you expect the numbers to continue to go up the next 2 weeks because of what we're seeing. What will it take for the numbers to go down?
So, when you look at other communities that are on the down slope of this, at least in Europe, where you're looking at cities that have had a big insult over 7 weeks, and we have just started, right? So we anticipate at least, probably peaking over the next week or so, and then taking still several weeks to come down to low levels, right? Before Christmas, we were in rates of like 2,000 as opposed to the 28,000 cases that were posted over the weekend. So we have a long ways away for Omicron to get through our community. The ways that we can prevent kind of that insult to injury to all the healthcare system is really we know the vaccines work. We need everybody to go out and get their boosters, and the boosters is the best way to prevent getting hospitalized or having serious illness and getting into the ICU. We need everybody to mask, right? And it's even more important with the latest CDC guidance of, people who are mildly symptomatic or have no symptoms after having 5 or 6 days of illness. And if you are feeling better at that point, you can go back, get out of isolation and go back to work. But the key point to that is that not only do you need to feel better, but you have to be wearing your mask for the rest of the 5 days to finish out that 10-day isolation.
And when you say feel better, does that mean no symptoms whatsoever?
In a perfect world, I would say no symptoms, but you would have to definitely have no fever for 24 hours and not taking anything to stop that fever, and, feeling considerably better. Sometimes people will, sometimes we'll still feel like, a little bit fatigued, but if you are able to do like your day-to-day activity, you're probably okay to get back to work.
All right, so is there any kind of vaccine or booster updates that we need to be aware of? You just had mentioned the boosters and such.
Yeah, so we're still recommending boosters, and this past week, the FDA as well as the CDC have cleared for 12-year-olds and up to get a booster vaccine, which is great. And you just have to wait 5 months for either having the Pfizer or Moderna. And so a lot of more people should be qualified to getting the boosters, and we really recommend for everybody to get them.
You know, some people are hearing that vaccinated people are getting breakthrough cases, and so then it leads them to question, why should they get the vaccine or the booster? So what do you say to them?
So we often, we hear that a lot, and a breakthrough case depends on a couple things. Like, we definitely are not seeing as much breakthrough in folks who've had their booster vaccine. So that's a reason to get it. The breakthrough cases, we're seeing a lot of people who got the original series, 10 months, 12 months. And so that's why the data suggests that everybody gets boosters at 5 months. And again, the vaccines do work tremendously. The fact that we only have like 25% of the people with COVID have been vaccinated in our hospital, as opposed to everybody. We know that the vaccine does work.
All right, so let me follow up with this, because we're hearing that Omicron, the symptoms are milder than the Delta variant and even more mild than that of the first original COVID-19. So some people think of it as like just a bad cold, which causes some people to say, I don't really need to take necessary precautions. So can you speak to that?
Yes, I think, folks who have other health problems, you are still a candidate for getting sick, and to the point where you're seeking medical care. If you are otherwise healthy, it can be considered just a cold, but it has larger implications outside of that one person, right? It's so transmissible that it's probably guaranteed everybody in your household gets it. So your kids get it. So your kids cannot be in school for 2 weeks, or your parents get it. And, and they have health problems, and they are most at risk to getting hospitalized if they're not vaccinated. So we really are asking everybody, even though you may not feel that you yourself are going to get sick, we need you to do it for the community, for your family, for your coworkers. We want to try to do as much as we can to prevent really overwhelming infections throughout different workplaces and schools.
I know a year ago at this time, we were also kind of in the same boat, but then things eased up like around March, April, May, June of last year. Do you anticipate that same kind of thing happening? Do we see COVID going away-ish?
It is hard to have a crystal ball of like what's going to happen. The rate that Omicron is in our community is no different than what we're seeing in New York or cities in Europe, where it's quickly spreading like wildfire. And so it has made a lot of industries come to a standstill. I'm not sure how many people have tried to go to a store or go to get takeout, and they realize the store is closed because their employees are sick, right? And or same thing in your workplace, that you're like, maybe 20% of people are gone because they're at home getting better. And so that's the important part. We're trying to really protect everybody so they're not so sick, and by really encouraging vaccination and mask wearing, even though that there's no mandate. The masks work to decrease transmission by 30%. And what we foresee is that people who have acquired Omicron have natural immunity, and hopefully this will keep any further like a Delta wave coming back. But it's really, I wouldn't be surprised if another variant comes, but it's hard to tell if it's going to be as impactful as this is.
Yeah, that domino effect that you're talking about, the restaurants, the stores, school bus drivers here in Guilford County, we're seeing it for sure. All right, what we want you to do is be able to ask your questions that you want to know and get the answer in real time. So here's what you're going to do. Text us your question, 336-379-5775, and Dr. Snider will be answering your questions when we come back after the break.